Hello and welcome to another exciting edition of the program Health Affair on AIT, a program where we discuss critical health issues with a view to finding lasting solutions. I am your host, Oshuomowa Daniels, and you're welcome. Every day we hear about coronavirus infection, Lassa fever, cancer, malaria, and other common diseases. But do you know that there are a lot of other neglected tropical diseases causing deformity and killing many Nigerians? We will be telling you more about these diseases after our news segment. Please stay tuned.
Lagos State government has confirmed 6 positive COVID-19 cases in a secondary boarding school on the mainland. A member of the school staff was confirmed positive for COVID-19 on the 2nd of November, and through contact tracing, it was revealed that a student and 4 contacts of the staff members were also positive for COVID-19. According to a press statement released by the Ministry of Health, the staff member fell ill for a few days and received first aid at the school clinic. She subsequently tested positive for COVID-19 on Monday, 2nd of November at the Lagos Biobank. The Commissioner for Health, Professor Akin Abayomi, has however assured the residents that the situation is under control. Lagos State government in early October 2020 had confirmed 181 COVID-19 infections in a private boarding school at Lekki.
As health leaders gather for a virtual section of the resumed 73rd World Health Assembly from the 9th to 14th of November 2020, the World Health Organization has 3 messages to share as follows: that the world can beat COVID-19 with science, solutions, and solidarity. Secondly, nations must not backslide on critical health goals. And thirdly, all must prepare for the next pandemic now. The World Health Assembly will consider a draft resolution that strengthens member states' preparedness for health emergencies through more robust compliance with the international health regulations of 2005. These resolutions will require global health communities and ensure that all countries are better equipped to detect and respond to cases of COVID-19 and other dangerous infectious diseases.
Interim analysis of the COVID-19 vaccine by one of the global multinational pharmaceutical companies has exceeded the expectations of many. According to a report, it is 90% effective. This news raises hope for a potential end to the COVID-19 pandemic that has claimed more than 1 million lives and battered global economies since 2019.
Welcome back. It is estimated that 122 million persons in Nigeria are at risk of one or more neglected tropical diseases. Until these diseases are taken care of, some experts say Nigeria may not be able to realize its sustainable development goals. On the program today, we have Dr. Chukwuma Anyaike to discuss the topic with us. Dr. Chukwuma Anyaike is the Director and National Coordinator, Neglected Tropical Diseases Elimination Program from the Federal Ministry of Health. So, Dr. Chukwuma, can you give us an overview of the neglected tropical diseases and areas where they are endemic?
The word neglected tropical diseases, a group of communicable diseases, sometimes they may not be communicable, that affect individuals that are mostly at the lowest ebb of the society. But I mean those that are poor, we call it disease of the poor, those you could find in the rural areas and the hard-to-reach areas. And Nigeria contributes very significantly to the burden of NTDs globally. According to WHO, we have over 1 billion people affected by neglected tropical diseases. And Africa contributes 90% of the burden. Surprisingly, Nigeria contributes 40% of the burden in Africa, probably because of our population. So we felt that This is a very serious problem. And for the fact that it affects people at the lowest level of their lives, people in the rural areas, they are neglected.
So, sir, give us some examples of the diseases.
Yeah, globally we have not less than 20, but in Nigeria we have not less than 12. Most of them, we already know them. We have the onchocerciasis, we call river blindness. We have the lymphatic filariasis. We have the B. hepatitis, or soil-transmitted helminthes. We have the trachoma. We have the leprosy, borreliosa, yaws, human artificial trypanosomiasis, the one we call sleeping sickness. Of course, we have guinea worm. Nigeria has been able to eliminate guinea worm. Recently, WHO just added snake bite and venom, one of the neglected diseases in the country. So we have not less than 12 of them. It causes people to go into disability. In fact, it's documented that neglected tropical diseases contributes highest burden of disability globally. And so it comes with a lot of socio-economic impacts, both to the individual, both to the family, to the community and society at large. The data we have shows that an average of 122 million individuals in the country are at risk of one or two or more of the neglected tropical diseases in Nigeria. They are endemic, and almost there's no part of this country that is not affected. We have 36 states plus Abuja. Every part of this country is affected, but there's variation in the endemicity. For instance, lymphatic filariasis. We have 774 local governments, but we have 583 local governments endemic. That's almost above 80%. And so there are other neglected tropical diseases. So if you do not have lymphatic filariasis, you could have worm infestation. In fact, worm infestation is higher than lymphatic filariasis because of poor environment, poor hygiene, and all what. If you come into Lagos, you could see that the slums, the good environment is very dirty and thereabout. Even in Abuja, you have it at the slums. Then when you go to the rural areas, they're very much, especially the hard to reach parts of the country. They are there.
Why are some of the diseases neglected?
Because it does not kill instantly. Do you understand me? Assuming it's like the Ebola or the COVID-19 that then it will trigger. But this one, it runs a very, long course that leaves people with disability. Someone that fends for the family, a man that goes out and fends for the family, suddenly cannot do that. It has a lot of ripple effect. You won't be able to do the normal work you do. You have to take care of your wives, your children, your neighbors, and thereabout. And so, that's why I said it keeps people in the trap of poverty. So someone that was very active, he could go and fend for the family, gain money, but suddenly could not do that. He gets blind. That's disability. Someone that's very, very healthy, he goes to work, comes back, a young man puts on his shoes and trousers and thereabout. All of a sudden, one of the legs gets swollen. He cannot wear trousers again. He cannot wear shoe. It prevents the person from going out to look for, fend for himself and for the family. Disability comes in. If, for instance, that place gets infected or thereabout, the legs get swollen or thereabout, to an extent, if it can be managed, the leg is cut off. Disability. Someone that has borreliosa, a very big gaping ulcer that is weeping. Sometimes if you see it, you won't be able to eat. Those are the ones you see. Sometimes you go to the marketplaces in the rural areas, you see them with those wounds. The elephantiasis are the ones with swollen legs. The ones with swollen scrotum. the hydrocele. And there's a lot of misconception. People think that because it runs a very long course, you could be bitten by a mosquito that transferred the filarial worms to you. After a long while, probably you started doing well. Maybe coincidentally you go to the village and come back, your leg starts swelling. You think, this particular uncle does not want my progress, or this particular witch in my company, and you go with that misconception that these people have come. Do you understand me? So with that misconception, if they have given you one poison, your legs cannot. You can't wear pairs of shoes again. You wear one leg. You can't even wear the trouser, pairs of trousers. You wear one, the other one you can't enter. So you are demobilized. You can't move out. It can be prevented, and there could be hope. For those that have been affected, we go into the secondary and tertiary stage of prevention. Because if already you have lymphatic filariasis, we could make life easier for you, tell you how to dress it, tell you how to live your normal life, and then work on your mental, aspect of it, because they feel dejected. For the people that their own manifestation was not limb swollen, probably the scrotum has swollen. And there's a misconception. Probably the person is very adulterous. They say, God don't punish him. Do you understand me? So God is punishment for him. So there's a program now where they will give the surgery, hydrocelectomy. The person is freer again and can be reintegrated. So for the people that have gotten blind, there's also they were integrated into the society. Remove that help them with that mental burden. And they could do that again. And then we'll put much emphasis on prevention. Prevention is better than cure. So that's why for those that we give drugs to prevent them having that, we give that. Especially those we give treatment. Because if we look like the lymphatic filariasis, it's the mosquito that bites that. And we give you drug on a yearly basis to reduce the infection on your blood, so that the next mosquito that bites wouldn't transfer it to the next person. So without be able to interrupt the transmission, and then we'll be on the next level of preventing and eliminating the disease. So it's treatable, it's preventable. All we need to do is to put the right thing and they pass the right information and the right message. If the drug comes to you, take the drug.
So how can we prevent these diseases? And for those already infected, how can we make them access treatment?
First principle is people should know that they exist. People should know that they are caused by ABC organisms. People should know that they are real. People should know that it's not due to, witchcraft or thereabout. That's number one. Awareness. Number two is to put the intervention, taking the appropriate drugs, taking care of the environment, improving your hygiene, thereabout. Third one is every person should be on deck. All hands should be on deck. The government, the private sector, the academia, the civil society, the pharmaceutical companies, and even the press, the media, help us speak for the voiceless so that they will know that this problem exists. If you're in Abuja, you won't see them. But if you go to the suburb, you see them. If you're in Lagos, you won't see them. But if you go to the suburb, you will see them. Do you understand me? Yeah. But they are there. No person speaks for them. So we want to speak for them because they are the voiceless. The government will know. The philanthropists will know. The people in the private sector will know. The government cannot do all. But if we put our hands together, we'll help. If we have 422 million people affected in this country, what's our population? If we have 422 million at risk, then we're sitting on a time bomb. And we're talking of poverty alleviation. You won't be able to alleviate poverty if neglected tropical disease is not addressed. And won't be able to achieve the universal health coverage if neglected tropical diseases are not addressed. So first principle, we should start with them. And because they cannot talk, that is why we're speaking for them. The people that have been affected will need to go to the closest primary health care. And that's why the government is talking about revitalizing the primary health care that will be able to take care of that. Because we do not need to go to the teaching hospital. We do not need to go to another place. The closest place, that is the closest primary health center, you go to that place, you take your drug. But most importantly, most of these ones, we distribute drugs on an annual basis. They will go from house to house because we want the communities to own it. We call them community drug distributors because we want the communities to own the program. So they are the ones who go to the gatekeepers in the community to say, who are those ones that are reliable in your community? So that we can give them the drugs. You will know everyone in the community and distribute this drug to individuals and they will swallow it. And as long as they keep swallowing it, they're on the verge of interacting the infection and they will leave Nigeria.
What is the call to action? What is the take-home message?
We need increased domestic funding, not from the government alone, from the private sector. We need strong commitment. Every hands must be on deck to ensure that we get this disease out of the country. Nigeria contributes 40% of it. As long as NTD exists, if Nigeria coughs, other African countries will catch cold. So, Nigeria should lead in this. If you get Nigeria out of NTDs, you will have taken care of 40% of the global burden. And this is the time to let every person know that it is doable. All we need is commitment.
Thank you very much for coming on the show. We appreciate you. Very topical issue. I'm sure you will agree with me. One major lesson I learned from Dr. Chukwuma is that improved hygiene is one of the prevention against most diseases. We'll be right back after this break. Please don't go away.
A healthy population, people often say, builds a prosperous nation. But many Nigerians are threatened on a daily basis and die needlessly due to diseases, poor health care, malnutrition, and lack of access to relevant information. The sorry state of our health infrastructure has also been a major challenge. On Health Affair, Oshomwa Daniels brings these challenges to the attention of relevant authorities for a lasting solution. For sponsorship and advert placements, please call the numbers showing on your screen. Health Affair, your access to good health through quality information.
Next is our nutrition segment, an aspect of the program where we preach the message of eating right to stay healthy. Our focus today is on lemon.
The lemon is a species of small evergreen tree in the flowering plant family, native to South Asia, primarily northeastern India. Lemon fruit is used for culinary and non-culinary purposes throughout the world, primarily for its juice, which has both culinary and cleansing uses. The juice of lemon is about 5 to 6% citric acid, with a pH of 2.2 giving it a sour taste. The distinctive sour taste of lemon juice makes it a key ingredient in drinks such as lemonade. Lemon promotes hydration. It is a good source of vitamin C. Lemon supports weight loss. It improves your skin quality. Lemon aids digestion and helps to prevent kidney stones. Experts recommend 1 or 2 glasses of lemon juice a day.
Welcome to our clinic, an aspect of the program where we get some vital health tips from the experts.
Never, ever, ever, ever ignore your body. The body gives you signs. Hardly do things happen suddenly. Heart attack, brain attack, this attack, they don't happen that suddenly. We call them sudden attack, yes. Sudden because we were ignorant or we were deaf or we ignored. The body has been trained by God to give you signs. It's like a car that the fuel is about to stop. It makes boom, 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 boom. It hardly does it stop, bam. So the heart doesn't shut down that way, unless there's a chronic invasion, acute invasions, right? Otherwise, it's a chronic matter. It keeps going worse and worse. That's why we need to do their medical checkup.
You can be a part of our perception segment by dialing the numbers showing on your screen. Your opinion about the health sector and general health issues is very critical to shaping the future.
The Lagos University Teaching Hospital has been at the forefront of running tests at an international standard level during every epidemic in this country, starting with Ebola, with Lassa fever, yellow fever, you name it. It's for Nigerians, it's for Lagosians, it's not for only federal or youth patients.
I met an old man here today. He was returned back home. If you were to go home and die there, who do you blame? Who do you blame? The government or the hospital? Too bad for this country.
We always announce we have spent this, we have spent. We are not seeing this expenditure. We are not seeing it reaching to the masses. We are not seeing the beneficiaries. And that is one mega problem.
See, Grace, e get one party, birthday party where they share for Jide house. Shey they come?
Me, I still dey care about this corona matter. I no wan come I beg.
But I think say Koro don't disappear for Nigeria now. No, it's still very much around, you know. It's just that the number of positive cases, them they on decline. So I beg, be careful. The opening about the sector of the economy no be excuse to let down your guard. Continue to observe all the basic rules, hygiene rules to stay safe.
A healthy population, people often say, builds a prosperous nation. But many Nigerians are threatened on a daily basis and die needlessly due to diseases, poor health care, malnutrition, and lack of access to relevant information. The sorry state of our health infrastructure has also been a major challenge. On Health Affair, Oshomoa Daniels brings these challenges to the attention of relevant authorities for a lasting solution. For sponsorship and advert placements, please call the numbers showing on your screen. Health Affair, your access to good health through quality information.
This is where we wrap up the show today. Please keep a date with us same time next week at 9:30 a.m. I remain your host, Oshomoa Daniels. Please keep staying safe.